There we go. How you doing, guys? Dr. Thompson here with Exemplify Health Center, Wellness Way affiliate, right here in Yorkville, Illinois. Sorry, I got ahead of myself. I am just heading home right now and wanted to jump on live. I got a text message from someone, a good friend, awesome person. He asked me this question. He said, hey, what do you do for high blood pressure? Okay. A lot of times I'm like, oh, there's needs to be more context. So there is no protocol for high blood pressure. There's no protocol for a lot of things. There's actually no protocol for weight loss. How do we know this? Because everybody's individual testing is going to dictate what their care is going to look like. So is there a protocol for high blood pressure? No. But here is what is really, really, really interesting is look at how medicine treats high blood pressure. In fact, we've gotten so many people off of blood pressure medications. It's unbelievable. In fact, it's happened so many times that the medical doctor, I've gotten a bad name with medical doctor because they're losing patients, all right? All right, so let me talk to you about high blood pressure and what the medical treatment is for high blood pressure, okay? There's really only 3 different types of medications that they use. Sometimes they'll use 1, sometimes they'll use 2. Sometimes they have to use all 3 because they're just grabbing at straws. The first one is they're basically just going to strip swelling from the body. So they're going to strip the body of water, all right? And this is going to involve, it's called an ACE inhibitor. So, basically what happens is you'll just lose water because they start messing with the lungs, and angiotensin converting enzyme is basically what it's called, and that will have an effect on the kidneys in order to start losing water. So basically you're just going to be losing some swelling, and if you lose basically some of your volume within your blood vessel, the blood pressure is actually going to go down. The next thing that they use is known as a calcium channel blocker, and so basically and the heart, if they're blocking the uptake of calcium into the heart muscle. And so then what happens is that the heart is not going to beat as hard. So you understand, if the heart's not beating as hard, then you're going to lower blood pressure. And then the last one is that they're actually blocking what's known as adrenaline. So they're blocking the production of adrenaline in the adrenal glands. And so what happens is kind of like, if you have a bear that's chasing you, then you release adrenaline and your blood pressure actually does in fact go up. It has to go up because you're going to need a higher blood pressure to start pumping blood and oxygen, especially to your extremities, so that you can run faster, jump higher, and do things like that. And here's what's interesting is that really one is due to inflammation. The other one can actually be due to a combination of things, but also some blood vessel inflexibility, and the other one is actually just solely due to stress. And so if they give you one and it works, that actually could have been the reason why. I've seen people on all 3 because they just don't know what to do, throw their hands up in the air, and they give the person 3 different blood pressure medications. I actually met with someone on last week that was mid-40s woman on 3 different blood pressure medications. So here's the thing. How do you lower blood pressure? Well, first and foremost is, do you have a lot of inflammation? If you have a lot of inflammation systemically, you're going to have a lot of swelling. You're going to have a lot of water retention, okay? And so first thing you have to start addressing is you have to start addressing, gosh, how much inflammation is taking place inside of the body. The second thing, though, is this person stressed? Because if they're on certain blood pressure medication that is actually blocking adrenaline production, then chances are, and it's working, chances are this person has a major stressor, whether it's mental, whether it's physical, whether it's some kind of massive chemical stressor that's really stressing out the adrenal glands and causing the adrenal glands to actually be producing more adrenaline as a stress response. The third thing that it can actually be that can cause some high blood pressure actually can be due to you have a lot of irritation of the vagus nerve, okay? Dr. Nate, what on earth is the vagus nerve? Well, it's a cranial nerve, and it runs right outside of the cranial vault, right next to the top bones in your neck, C1, C2. And it actually wanders, and it's involved in everything involved with rest and digest. This is what's interesting, is that they realize that, man, if you can actually stimulate the vagus nerve and get it back to normal, they found that blood pressure will actually go down better than blood pressure medications. We actually do that all the time when we're actually adjusting in our office and correcting the alignment of the top bone of the neck in relation to like the second C2 and the skull, the occiput. Man, there's amazing things that can happen when that happens, and people's blood pressure will actually go down if there is actually a problem there. So is it inflammation? Is it just because of just massive stressors? Is it vagus nerve issues? And the last one is too, this is really interesting and fascinating, and this actually will happen more often as people get older, is do they have some problems with what's known as methylation? And so methylation is just a big word for donating a carbon and 3 hydrogens in order to make specific things inside of the body. It's the most common enzyme reaction. Most of it happens in the liver, but here's what's interesting. What's interesting is that this methylation actually happens in the blood vessel lining, so that the blood vessel lining can make something known as nitric oxide. This is what's fascinating, the production of nitric oxide. So what happens with nitric oxide production, or if you're not making enough nitric oxide, is that the blood vessels lose the ability to be able to expand. And when the blood vessels expand, pressure actually goes down. I think that's physics, if I'm not mistaken. So as it expands, you need less pressure to be able to go through the heart. And if it contracts, you're going to have a higher blood pressure. So some of it can be due to methylation. Now, some people have problems with methylation just in general, because they might have things like MTHFR, they might have a toxic liver. And somehow, some ways you can see that might be the issue, is because if in the past you've had very high levels of toxic exposure, you've had gallbladder out, you've had problems with hormone metabolism and things like that, and that can be an issue when it comes to methylation. This is why, guys, don't run out and go to the store and get this, but this is why things like beets can actually help with nitric oxide production. They don't actually help with nitric oxide production per se, but they help with methylation. And so this is why high levels of beets actually can help to relax the arterial walls. I know that all of you are going to go out and just go buy a bunch of beetroots and things like that. And you're going to wonder why it didn't work, because that wasn't the main issue. So how do you know what the main issue is when it comes to high blood pressure? Well, you have to test. So you have to test, and you have to look at, gosh, what are the inflammatory levels? What are the blood sugar levels? How many food allergies do you have? Do you have an infection that's going on? There's a lot of different factors, and the only way to know for sure, guys, is that you actually have to test. So, but blood pressure, remember, medicine can only handle it in 3 ways. Calcium, blocking calcium uptake in the heart, stripping the body of water, or they're just blocking adrenaline production. So that's the 3 things that they really can do. But they're never still getting to the cause, and they're never getting to the reason why. So going back to the question that was asked, Dr. Nate, how do you lower blood pressure? My response was, get off of the big toe, all right? Because remember, your big toe controls your heart. And I know you're thinking, that's absolutely stupid. But if I came and I took a hammer and I smashed your big toe, chances are your blood pressure is going to go up. And why is that? Because you are stressed and in pain, and because your big toe is throbbing. And that's how you know that the body, there's not one thing that makes blood pressure go up, that the body works like a Swiss watch. Is that literally something happening in the gut can cause high blood pressure. Like something that mentally is stressing you out can cause high blood pressure. And that's why you have to look at it from a whole body approach, like a Swiss watch, versus going to the specialist who is going to look at the heart and is going to manipulate the blood pressure, and then is going to step back and say, we did a great job. But meanwhile, what they never look at is all of the side effects of the medication and how it will cause other issues in other parts of the body, which then will produce more symptoms and more illness, in which you go and then have to go to another specialist. And that's how you enter into the system that absolutely drives me and also drives patients bonkers, because once you go into the system, all you start doing is starting to run after and chase your tail, because you're chasing after symptoms and you're not actually finding the causes. So hopefully, guys, that makes a lot of sense. So how do you guys know? You have to test. You have to see what is smashing the big toe. And when you do that, remember the normal process of the body. The normal process of the body is to return to normal, to return to health, and to return to a healthy level of adaptation. Guys, I hope that makes sense. I just had to go live and just say that, because I know if I get that question, there's a lot of other people who are probably thinking that as well. So if that makes sense, guys, please share this video with other people. Let them know, especially if they're on a blood pressure medication. There is hope. We have gotten a lot of people off of blood pressure medication. Not that I actually can take them off of it, but we help them with their doctor to be able to take them off of it. That's the biggest thing, is that if you can't find a doctor who wants you to get off of a medication, who isn't going to be supporting your plan to be able to get off a medication, and people say, well, what do I do? And I say, it's easy. You find a new doctor who is going to actually come up with a plan to be able to taper you off of some of these medications, because that's what the goal of being a doctor is. The goal of a doctor is actually health, and not to constantly put out fires to where you're 60 years of age and you are limping along, but you're still alive, but you're limping along. That's not how we're supposed to live. So guys, be well. Hope you have a great night. I'm heading in and going to see the family. So appreciate all of you. Share this video again. We will see you very soon.